Hello, I will be doing my CVAD blood draw. This is my patient. This is the CVAD I made, the clamp, and these are my items. I do have gloves, alcohol wipes. I got my biohazard bag. I got my sharps container. I got my new cap. I got my blood collection. I got needles to transfer later, and I will be using this for my two 10 ml flushes and my sterile syringe. I will be using it for all three, but I will be stating when I dispose and use of a new one. Okay, so I will go ahead and place it right here. Nothing on my wall, on my sides, nothing, just my area, just to show my area. All right, now I'm gonna go ahead and do my video. So before I go into patient's room, I'm gonna go ahead and verify the order, look at it, and be like, all right, this is what needs to be done, verifying everything that needs to be done. I'm gonna go ahead and check all the supplies and make sure they are ready before I go into the patient's room. So like I said, I have the alcohol wipes, the two 10 ml flushes, the one sterile syringe, biohazard bag, needles container, new cap, blood collector, my gloves. So I'm gonna go ahead, knock in, hello. Hi, my name is Will. I will be your nurse today. Go ahead and do hand hygiene. Hi, I've been ordered to do a blood draw on you on your central line. Can I get your name and date of birth, sir? Okay, Mr. Bear, 01/01/1980. I will go ahead and use the second patient identifier on the wrist to see if it matches up. Everything matches up. Perfect. All right, Mr. Bear. Are you allergic to anything? To any latex? To any penicillin? Allergic to anything? No? Okay, cool. So I'm gonna go ahead and raise this to my hips. For me, I'm gonna go ahead and do patient privacy. Close the curtains, and then just wanna let you know that try not to move as much as you can. I'm gonna try to make this as fast for you, but I'm gonna make sure I'm gonna do everything correctly for you, Mr. Bear. Again, you are not allergic to anything. Raise the bed. All right. So I will be telling you more things to do about after I do everything. So I'm gonna go ahead. I did my hand hygiene. Go ahead and grab my gloves. All right. I'm gonna go ahead and check the CVA for any indications of infection. So what I will be doing for is I will be looking if there's any redness, swelling, discharge, arrhythmia around the area. No, everything seems to look fine. Okay, so now I'm gonna go ahead and temporarily stop if there's any infusing and disconnect the IV to the access port. So I'm gonna disconnect it, and then I'm gonna go ahead and clamp. See me? Gotcha. Okay, now I'm gonna grab an alcohol wipe, and I'm gonna go ahead and clean the lumen. Clean it really well with friction. All right, and I'm gonna make sure it dries before I do anything. Get rid of that. Okay, now I'm going to grab a 10 milliliter, 10 ml flush, and what I am going to do is I am now going to connect it to the lumen, and then I am going to remove the clamp. And what I'm going to first do is I'm going to withdraw blood to all the way to the syringe, but not inside the syringe. So just to the top, so right here. And then what I'm going to do is I'm going to do a pause and push method, the pulsate method, to flush the 10 mLs in there. So pause all the way. Perfect. Now what I'm going to do is I'm going to aspirate and I'm going to withdraw blood. And it's going to be the pause and pull method, so the same thing, but pulling all the way. And it did state that I should withdraw around 3 ml to 6 ml for discarding. So I'm going to withdraw 3 ml to 6 ml. Perfect. Got that amount. Remove it. I'm going to clamp. And now I'm going to discard this one. So discard in here. Okay. Now I am going to use a sterile syringe, and now I'm going to connect it in here, and this is going to be the blood that I send to the laboratory. So now I'm going to connect it, and I'm going to unclamp, connect, unclamp, and now I am going to withdraw the the blood that I will be using, the correct amount that I need, and it will be using the pause pull method again. Perfect, got my amount, and now I'm going to disconnect. And now I am going to put a clamp. Perfect. So now what I'm going to do is I'm going to use this for visual. This is the one that I got from here. And now I'm going to make sure I put a needle, clean needle, and connect it to the top. Here. Alright, perfect. And I will now transfer the blood to the blood container. Alright. Gonna put all the blood in here. And since this is the needle that I got, the syringe that I got, the sterile syringe, I'm gonna also dispose of this in here. Have my blood to the side, make sure I can see it at all times. And then what I'm going to do is now I'm going to grab the last 10 ml flush, this one, and now I'm going to disconnect. I'm not disconnect, but remove the clamp. And now I'm going to do the pulsate method again by flushing the fluid back inside. Perfect. Now what I'm going to do is I'm going to clamp. And then now dispose of this. Boom. And now what I am going to do is grab another wipe, and I am going to clean the port. Clean it. Make sure it dries off again. And now I'm going to use a literal cap to tap it on, right? Now I'm going to remove the clamp, and I'm going to turn on the infusing, if there's any infusing, and connect to the access pad, the access port for the IV. So I'm going to connect everything, turn it back on. Everything is set. Now what I'm going to do is I'm going to write my name, my initials. So I'm going to do WL, the date, today's date, the time, and I'm going to do where I would do the blood. So I'm going to just say CVAD. Perfect. Now I'm going to go ahead and put this in the biohazard bag. Okay. And then before Mr. Bear, I go off. Is everything okay? Do you feel okay? Feel good? Okay. Just make sure. I just want to make sure you know to not get this wet. If you do need a bath, you're gonna need we could order a sponge bath for you. But everything went well. So make sure you're okay. If you need me, the call light is ready. And then now I'm gonna go ahead and send this to the laboratory. Yes. And that is my CVAD. I'm gonna throw away everything. Make sure everything was in reach on the bed. I'm gonna make sure dispose of everything, the needles, the sharps, and alcohol. And that is my CVAD blood draw.